We feel like we have these lead blankets on our lungs.
I have been sick for about 23 days now.
What a Kafka-esque nightmare this has all been. Not being able to breathe, the dry cough doesn't count, the fever doesn't count.
They basically took my temperature, asked me some questions, quickly came back and was like, this is a waste of our time, your time, and then just sent me back.
You have reached the New York State Coronavirus Hotline. If you are concerned that you have been in contact with someone who has COVID-19 and would like testing, press 1.
All of our representatives are busy. Your estimated wait time is between 255 and 265 minutes.
Anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful.
The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that.
My wife Rebecca and I live in Lillian, Alabama, and have been experiencing minor symptoms of the coronavirus. We can't find tests. We've contacted our primary care physician. We've contacted emergency rooms, local health department, state health department, coronavirus hotline, and the CDC.
I started to have chest tightness, headaches, body aches, fatigue, and that still didn't qualify me for a coronavirus test.
Luckily, my symptoms were mild. My fiance's symptoms were pretty bad, like 10 times what the worst flu is. She works with a high-risk population. She visits lots of hospitals, which is how they think she got it. It took us 2 or 3 weeks of begging, of going to different doctors, of calling the CDC, of calling pretty much everyone we could, and we kept getting the same response, that we didn't qualify for a test.
I originally wanted to get tested because I just noticed everybody at my work started kind of coughing, sneezing. I just went to urgent care to see if I had the flu.
Closest up and running testing center to us is in Birmingham. That's a 3-hour drive from us. When we contacted them, we were told it could be up to a 3-day wait. There's nothing they can do. If we want to come up and get tested, we have to be willing to wait.
I'm not an MD, but I work in allied healthcare as a specialist care provider, and we have an absurdly low level of COVID-19 testing. So reasonably last week, I called the health department to ask if I could or should get tested, and they said I couldn't be tested because I wasn't symptomatic. And I told them, well, I've been around people who were suspected, and the health department said since those people weren't tested to show if they were a true positive, that I also was not allowed to get tested.
I was prescribed a penicillin-based antibiotic over the phone. Doctors aren't really seeing people in person right now. I think that I have the right to know if I have the coronavirus or not.
Based on what we heard here in Texas, you have to be in the hospital, like legitimately dying before they test you. And even then, if they're pretty sure that it's coronavirus, they don't bother testing you because they want to save the tests.
I'm not allowed to get quarantined because I can't get tested to know if I'm positive. I don't have a reason to furlough myself from my job or to take FMLA or anything else. I'm still not clear why the health department wants to use so few tests. I think more testing would be helpful, and it seems like the current plan is to just delay this long enough to hope that there's a cure. But I feel like that's even giving more credit to the local and federal health departments than they seem to deserve right now.
We constantly hear about these athletes, politicians, actors, wealthy, being able to get access to tests. But then you have the rest of us just left hung out to dry.